Okay, well, good afternoon, and we'll get the COVID afternoon briefing started. Joe McComb, Mayor, City of Corpus Christi, we're glad you're with us. We continue to encourage you to help us in this fight. I think we're making some significant progress. The City Manager, Peter Zanoni, will be here in a minute to give you the details of what where we are today. I do want to commend those that are paying attention to following the instructions of wearing a face mask. Doesn't mean you have to like wearing a face mask. There's a lot of people I know, friends of mine, and I'm one of them, friend of myself, that aren't real crazy about wearing one, but I can assure you that it's because of my concern both for protecting me, but primarily for protecting my family and friends, and particularly my grandchildren. So if I've got a little inconvenience to endure, well, I'm willing to do that. And so I'm asking you to do that, and those of you that feel like that you don't want to do that, well, think of other people and try to help us win this battle. I think our numbers are coming down, and that's a good sign, and hopefully that we'll continue to make progress on this. But again, a word of thanks to the medical professionals that are out there fighting this on a day-to-day, 24/7 basis. Thank you for your time and your dedication and your commitment, and we appreciate that very much. But these briefings, we're trying to get them to be briefings. Sometimes they get a little long, but we're trying to make them brief because you're basically here to get some basic information, and that's what we want to do. So today, Peter Zanoni will be giving you the statistics of where we are. I've not seen the numbers, but I understand that we're continuing to make the decline, and the data dumps are getting smaller, so that means they're either catching up or there's fewer numbers to report. Hopefully it's fewer numbers I hope they're caught up, but second, I hope there's fewer numbers each day for them to report to us, because I think the whole community will be really excited one of these days when they hit that zero. You'll probably hear a spontaneous hand clapping across the city when that happens. So Mr. Zanoni, if you'd come, and then Annette Rodriguez will be coming to give us her report from the Health District. And next week, Senator Cornyn will be in town to visit with us about what we're doing in our coronavirus response, as well as what the federal government has done for us and what we need them to do for us in the future. And that, again, reminds me to remind you that these federal dollars, whether they be for coronavirus assistance or whether they be for CDBG block grant funds for other things, it's all based on population. And so they're going to quit taking the census, I believe, on September the 30th. So we want to encourage everyone, if you're not completed your census information, please do that, because I've heard a number somewhere between 1,100 and 1,500 per person difference it makes when it's reported to Washington, because that's how they send their money back to the states. And Texas is a net exporter of dollars to Washington. In other words, we're sending more dollars to Washington than Washington's sending back to us. And it's because the population count is how you get your money from Washington. And so if you want to get your money back here to do some things that will benefit your community, you need to make sure that you're registered in the census. So you've got some time to do it, but don't wait any longer. Get yourself registered, identified, to fill out the census forms, and help us, not only in the COVID reimbursement, but for other monies through the next decade. And you figure at $1,000 to $1,500 per person difference, that can mean millions of dollars over a 10-year period. So, Mr. Zanoni, if you'll come and give us the COVID information.
Parece que hemos estado haciendo progresos significativos, pero le seguimos pidiendo que tome todas sus medidas sanitarias, sobre todo para proteger a sus seres queridos. Una vez más, quiero agradecer a la comunidad médica por todo su trabajo y sobre todo su compromiso con nuestra comunidad. Recuerde también participar en el censo para que así sigamos contando con el apoyo federal. Ese apoyo nos ayuda para muchas cosas, incluyendo los gastos para combatir este virus. Le pedimos no espere al último día y participe. Ahora el administrador de la ciudad, Peter Zanoni, nos va a entregar su reporte.
All right, good afternoon, everybody. I'm Peter Zanoni, Corpus Christi City Manager, and I'm going to provide you with the statistics and the number of new cases for today, talk to you about hospitalizations and number of deaths, and show you a few trend charts, okay? And so let's look at the number of new cases for today. We're reporting 97 new cases for today, as you can see in this chart. Now, we haven't been here since last week, so let's take a moment just to look at the past several days. This is Tuesday, Monday, Sunday, Saturday, and then last week. So that three, you know what, let's go to the next graph if you can. Okay, so this graph here takes those same numbers we just saw, and then the yellow bars are the state data drops that we're getting, and we're able to assign them into the right day. And so you can see we don't have the two totaled, because we want to still differentiate between the number of cases from the state data drops versus the number of new cases that we announce here from our labs and other labs through the city's database. So you can see if you look at the blue bars, except for that 308 day, our numbers have been relatively lower, about a third or so, even a fourth in some cases of what they were when we were at the peak. And so what you can see again for today is 97, a little bit higher than yesterday, but somewhat consistent for the past couple of days. Today, not shown on here because we already distributed them, we did get another data drop for 101 cases. So not only did we report the 97, but there was 101 reported from the state. And those have already been distributed in some of the yellow that you can see here, but the distribution dates for the most recent data drop, the one for today, was from June 24th through August 13. So there's a couple of days on here. We have the 5th of August to the 13th of August, but those cases went back as far as June 24. Okay, so that's the most recent cases then for today. And if we look at the next graph, we've put the two on top of each other. So you can kind of see a trend with the numbers we announce here from our sources and then what the state tells us that they've announced here for Nueces County. So you can see the trend, and I'll show you later on another graph, but you can see we reached the peak probably around that 13th or 15th of July, and then we've been slowly coming down to where we're at today. We still continue to do testing, and Annette's going to talk a little bit about that when she comes up. What this chart does show us in that far left corner, if you can see it, is we've received 9 data drops from the state, and they were from July 31 was the first, August 9, 10, there was one on the 13th, 14th, 15th, 16th, 18th. So 9 data drops, and we've assigned them into the appropriate days when the cases were pronounced to be confirmed positive. Okay, now another good fact here is that the number of persons recovered for the first time in several weeks, probably over a month at least, the number of cases recovered is greater than the number of cases that are active. And so the orange now represents the recovered cases. That's 54%. Last week we were about 50-50, but now we're 54% of all the cases are recovered, and then 46% are not recovered. They're active cases. So a little over 9,000 persons have recovered, and we still do have about 7,850 active cases. And there's 295 deaths, and we'll show you that in a moment, what that means for today and what the trend looks like for the number of deaths. And the number of hospitalizations you can see here is it's a little bit it's consistent in that it's lower than what it was. We did have 4 additional persons in the hospital today, so 234 in the hospital. Yesterday it was 230, and over the weekend it was about 229, 231, so it's been about 230. It went up by 4 today. What you can't see on here is the date range going back to the high point when we had that peak, and that would be July 24, and that's when we had 430 people recovering in the hospital. So today's number is about half of that, about 50% of that high peak are in the hospital. It's still a big number, the 234, and it's still probably taxing the hospital systems, and especially the nurses and people that are tired working, but 234 today. The high back in July 24th was 430 people in the hospital on that day. And then when we look at those that are in the hospital, so of the 234, 85 of those people are in intensive care situation in the hospital, and that is a decrease of 2 people compared to yesterday when we had 87 people in ICU. And then the number of deaths I mentioned a moment ago was 295 since we've been reporting and counting COVID-19 related deaths. That is 5 more than yesterday. So yesterday we had 290 people that we reported to have died from COVID-19. Today's 5 additional deaths puts us at 295. And then this is one more trend graph. This shows us our daily counts in the blue. And these do reflect the data dumps being added in. So the daily counts, and then the red line shows the 7-day running average. And that number also has come down in half compared to the last couple of weeks. And so the 7-day daily average, when you look at the past 7 days, that daily average is 90 cases per day. And 2 weeks ago, it was over 200. Last week, it was in the 100s number. So we're below 100, and we're below 200, which is good. So 90 is still high, but it's better than where we were. And that's reflective of the line here. You can see the peak, and it's slowly coming down. We still have a little bit way to go, but making progress. Okay, so that concludes my presentation. I just did want to add one more thing since I'm up here, is on our lineup for the next couple of weeks. So today we're here, the mayor, myself, and Annette. On Thursday, we will have Dr. Bird from Texas A&M. It's going to be primarily focused on them. We'll do a quick update on the numbers, and then let Dr. Bird and the A&M team spend most of that meeting talking to the community. And then we're gonna swap the days so that Dr. Bird comes in on Tuesdays from now on after this week because of his schedule at the university. And so he'll be here Thursday the 20th, and he's going to come back on Tuesday the 25th of August. And then from that point forward, he'll be here every Tuesday. And then the mayor, the judge, myself, and others and Annette will speak to the community on Thursdays, okay? So we still have the Tuesday, Thursday lineup. This week on the 20th, Dr. Bird will be here, and then he's going to switch, and he'll be here on Tuesday, the 25th, and he'll continue on every Tuesday. We'll be here every Thursday, including next week, the Thursday, the 27th, okay? So Gabby's going to translate this into Spanish, and then we're going to have Annette Rodriguez, our public health director, come up and speak to us about certain items. Thank you.
En las últimas 24 horas se han reportado 97 casos confirmados por el coronavirus, haciendo un total de 17,221 casos. El Estado nos reporta 101 casos para hoy, casos que datan desde el 24 de junio. 9,175 pacientes se han recuperado por completo, 234 personas continúan en el hospital, 85 están en la unidad de cuidados intensivos, 7,852 son casos aún activos. El día de hoy se reportan 5 fallecimientos. A la fecha, los fallecimientos totalizan 295 personas. Actualmente, y por primera ocasión, más personas se han recuperado a comparación de los casos activos. La tendencia de casos positivos en promedio en los últimos 7 días es de 90, el cual sigue disminuyendo. Este jueves vamos a tener la presentación de la Universidad Texas A&M en lugar del día viernes. Posteriormente, esas presentaciones serán todos los martes debido al comienzo de clases en la universidad.
Good afternoon. Annette Rodriguez, Public Health Director. My condolences go out to the families of the 5 individuals that lost their fight against COVID-19 today. The Health District's next COVID-19 drive-through is scheduled for tomorrow at the Health District. If you are having COVID-19 symptoms, please call the 826-7200 to be screened. We have 33 people scheduled. The state testing team is also still testing at the American Bank Center tomorrow until Friday from 9 to 1 p.m. If you are COVID-19 positive and you need medical help or advice to manage your health, there is an outpatient COVID-19 clinic where you can get assistance. The number is 361-826-8019. All COVID-19 positives that are swabbed through our drive-through also receive a pulse ox reading. If it is determined their oxygen saturation levels are low, they are advised to seek medical attention with their PCP or at our COVID-19 outpatient clinic. The clinic is staffed with COVID-19 medical experts and has assisted over 35 patients through telemedicine. To change gears for a minute, the Texas Department of State Health Services notified the Health District of a positive mosquito pool in zip code 78408 that was identified to have St. Louis encephalitis virus in Nueces County. St. Louis encephalitis is sometimes referred to as SLE, is a viral disease spread to people by the bite of an infected mosquito. Illness usually occurs abruptly. Symptoms include fever, headache, nausea, vomiting, and many times a loss of mental status. Older adults may get stiff neck and sometimes develop encephalitis. Symptoms appear from 5 to 15 days after the bite of an infected mosquito. Currently, there are no vaccines to prevent nor medications to treat SLE. Protect yourself from infection of SLE by avoiding periods of high mosquito activity, which are dawn and dusk, wearing long pants and long sleeves when outdoors, and by using a mosquito repellent that contains DEET is helpful in making sure that you do not get bit by these potentially infected mosquitoes. Vector control staff have also added additional spraying measures for this area. I do have some really good news. City Manager Zanoni mentioned it as well. We're finally starting to see COVID cases decrease, not just locally, but as well as nationally. This is good news for everyone, but still, it's not the time to let your guard down. Thank you to the community for wearing your mask when out in public. We must continue to practice the public health strategies. We should be even more vigilant as we head into flu season and possibly face-to-face instruction for our school-age students. Continue wearing your mask and wear it properly and consistently, not below the nose, but above the nose to cover both your nose and mouth. Do not remove your mask while around strangers outside of your family bubble. That moment you take a break from COVID could be the moment that you get infected by COVID-19. As Dr. Bird says, if you do not find the loopholes in your businesses or in your facilities, COVID-19 will find you. I give everyone this example because I was raised by teachers. Teachers will wear their mask all day long in the classroom with their students, but the minute they have a conference period or an off period, they will go into the teacher's lounge and take off their mask. They'll start telling each other how hard it is to wear the mask all day long. That's when the health district will get a call and someone from the school inevitably will say, "You're not going to believe this. We wore a mask the whole day, except when we took a break and went into the teacher's lounge. And now one of the teachers says she found out she is COVID positive." Oh, I believe. All too well, I believe. Wear your mask. Social distance. Wash your hands as often as possible. Studies show that the more often you take hand washing breaks in school, the more successful those schools have been in keeping viruses like the flu from causing outbreaks. Avoid being around people who are sick. Disinfect, frequently touch common surfaces. Don't touch your eyes, nose, and mouth without washing your hands first. and do your part to continue to reduce the transmission of COVID-19. Stay well, stay committed to this battle, and stay informed. Thank you.
Primeramente, queremos dar nuestro más sentido pésame a los familiares de las personas que han fallecido debido al virus. La próxima toma de especímenes será el día de mañana. Ya hay 33 personas registradas en el estado. El estado también estará tomando muestras el día miércoles, jueves y viernes en el ABC. Se le pide llamar al 826-7200 para una evaluación previa. Si resulta positivo para COVID-19 y necesita asesoramiento médico, hay una clínica para pacientes ambulatorios. El número a llamar es el 826-8019. Las personas examinadas por el distrito también reciben una lectura de pulso ox. Si sus niveles de saturación de oxígeno son bajos, se le recomienda que busque atención médica con su médico de cabecera o en nuestra clínica ambulatoria. En cuanto al reporte por un mosquito portador del virus de la encefalitis de St. Louis, ese virus puede causar una enfermedad viral transmitida al ser humano por la picadura de un mosquito infectado. Los síntomas incluyen fiebre, dolor de cabeza, náuseas, vómitos y muchas veces pérdida del estado mental. Los adultos mayores pueden presentar rigidez en el cuello y algunos desarrollarán encefalitis. Los síntomas aparecen de 5 a 15 días después de la picadura de un mosquito infectado. Actualmente no existen vacunas para prevenir ni medicamentos para tratar el encefalitis por ese virus. Protéjase de la picadura del mosquito evitando actividades al aire libre durante el amanecer y el anochecer. Use pantalones y blusas de manga larga, además de utilizar un repelente que contenga DEET. El control de plagas ha implementado medidas de fumigación adicionales en el área donde fue reportado el mosquito. Regresando al COVID, finalmente estamos comenzando a ver que los casos disminuyen a nivel nacional y local. Esta es una buena noticia para todos, pero aún no es el momento de bajar la guardia. Gracias a la comunidad por usar su cubrebocas cuando esté en público. Le pedimos seguir practicando las estrategias de salud pública. La temporada de influenza y posiblemente instrucción en persona están a la vuelta de la esquina. Los maestros se espera utilicen cubrebocas durante su instrucción, pero es en los periodos de descanso cuando toma solo unos segundos para bajar la guardia y contraer el virus. Le pedimos que continúe tomando todas las medidas sanitarias hasta que pase esta emergencia.
Okay, thank you. That concludes the presentations. Has media got any questions for Ms. Rodriguez or the city manager or myself? All right, well, that will finish us up for today. We'll see you back here Thursday, Dr. Byrd, at 5 o'clock, and then next week on Tuesday, Dr. Byrd, and Thursday will be the city manager, Annette, myself, and the judge, and whoever else. So thank you very much. Stay safe.